Welcome to Deuk Spine. 2, 3, 4, 5, 6. Our patient is having a Deuk laser disc repair. AP. This is a endoscopic spine surgery, quick. And I'm using perfect lateral. Using the X-ray machine to navigate and localize. Shot. Perfect. All right. This patient has herniated discs in his neck. 2. Let's count. C2, C3, C4, C5, C6. Everyone agree we're at 5, 6? All right. Our patient needs 2 discs fixed, C4, 5, C5, 6. We're going to first access them, and then we're going to do a discogram. Shot? All right. So the needle is in C5, 6. I'm going to inject some dye to do a discogram. That's what a discogram is. Now, there's 2 types of discograms. I need a shoulder pull, Luis. There's evocative and provocative. Shot. Perfect. Let me just do a quick shot. There it is. Look at that tear. Beautiful. This is an amazing discogram. So there's evocative, provocative discogram, which you're evoking a response. Look at the herniation. Show us the herniation sticking in the back there. Huge herniation. Show us the tear, the annular tear where the herniation came out. Good. Perfect. Good job, Jordan. The other type of discogram is called a chromodiscogram, and today we're doing a chromodiscogram. Num. The difference is an evocative discogram is done for diagnostic purposes. A chromodiscogram is done, well, for diagnostic as well, but not to diagnose the source of pain. We already know what needs to be fixed, so we don't need a evocative, provocative discogram. We need a chromo. We need to look at the chromo means, obviously, color. We need a chromodiscogram. Shot? Because I want to stain the herniated, degenerated disc with blue. All right. Are you guys ready? So we have now accessed the disc through the front. This is a transdiscal procedure. I learned this procedure in Korea from the Koreans, Dr. Sang-ho Lee, who was the pioneer, and Dr. Gun Choi, his assistant, both neurosurgeons in South Korea. The incision is 4 millimeters. Unlike open surgery such as ACDF or artificial disc, everything is done arthroscopically with a small incision. Bringing the needle out, leaving the guide wire in. See the guide wire there? Show us the guide wire, Jordan. Yep. Now the nice thing about this surgery is it's pretty much bloodless. We lose a few drops of blood, that's it. And actually it's funny because this is not his first surgery, this is his second one. We did his surgery a few months ago. We were supposed to fix 3 discs. We got into the first one and he just had a lot of bleeding. It wasn't because we hit an artery or vein, it's because he just couldn't coagulate his blood. Now he's doing a good job. Not having the same problem yet. So let's hope it stays that way. So we had to bring him back after he recovered, try to figure out why he was bleeding, and then of course get approval from his insurance. His insurance is covering the surgery. And then get him scheduled. So here he is, round 2. We did C6, 7 last time, which was a miracle. I don't know how we got there, but we did. He's got very broad shoulders. He's a big guy, huge. Shot. And big guys have, we have difficulty getting in sometimes into their neck, into the disc, because they're so big. AP. So now I want to go and do a front back view. We've already been looking at the side. We're happy with the fact that we're at C5, 6. We've counted. Now we want to do a front back and make sure. Oh yeah, that's beautiful. So we're just to the right of midline. You can see show them the annular tears on that picture. Show them the nerve root, the herniation. So first of all, look at the annular tear. It's the black line in the back of the disc. You got a left and a right. Okay. Then you got some blush of the dye around the nerve root on the patient's right side. The other side is better. Yeah. So you see how close the tear is to the nerve root. As a matter of fact, anything leaking out the tear gets around the nerve root. You can see that clearly. All right. At this point, I'm going to remove the guide wire and I'm going to advance this dilator. The dilator is going to go through the disc and get to the back of the disc. Shot. I need to be in the back of this disc. That's where the herniation is. Shot. All right, we're pretty much almost there. Shot. A little bit further. That's really good right there. I'm happy with that. Henry?
Yes, sir.
Let's show the audience. We've only lost 2 drops of blood, okay? That's the whole surgery. We're going to lose 2 drops of blood. This is the tube the whole surgery is done through. It's called a tubular retractor. Now, this is not a percutaneous procedure because percutaneous procedures are done with needles through the skin. This is a true surgery. It's endoscopic or arthroscopic. Yeah, that's fine. Thank you, Luis. The tube diameter is 4 millimeters, okay? So the whole surgery is done through a 4 millimeter tube, which is why there's no need for, there's no bleeding, there's no scar tissue, there's no damage to his muscles in his neck or damage to the arteries and veins. There's no damage to the ligaments. It's basically a spreading of these structures, spreading them apart. And a lot of people don't realize that our bodies are made up of tissues that have fibers. What is a fiber? If you've ever looked carefully at your shirt, really close. As a matter of fact, this right here is a perfect example, Henry. Okay, if you look at this, it's got fibers, which are, the material are strings. Okay? You know, at first glance it may look like it's solid, but it's not. It's actually made up of these fibers. Okay? And we push right through the fibers, spread them apart. We don't cut them. Now, when you get open surgery like ACDF, laminectomy, artificial disc, you're basically cutting the fibers. You can't do it without cutting the fibers, but not with laser, not with Deuk laser disc repair. Endoscopic, there is no cutting of fibers. As I advance the tube through his disc, I'm looking at the back of the disc. I'm checking the tip of the dilator to make sure it's not moving significantly. I don't want it moving backwards too much. I want it to stay where it is. Shot. And that's it right there. That should be good right there. You can actually feel when you get to the back of the disc because there's always a little bone spur back there, a lip, and the lip kind of stops you from advancing. Don't need to remove it. Henry, let's show the audience how a herniated disc, also known as a bulging disc, even degenerated disc, slip disc, ruptured disc, protruding disc, extruding disc, all those are the same thing. It's basically an injured disc. Let's show them how that causes so much pain in the neck, headaches, and arm symptoms. It's all due to inflammation. Check this video out. All right, welcome back. You've seen now from our video that there's a tear in the back of the disc called an annular tear. there's a wall around the disc called the annulus fibrosus. It's made up of collagen and elastin. We're looking at it right now. We're cleaning it out. And that wall goes up and down from the top bone to the bottom bone. And it's real tough. It's like as strong as a pair of blue jeans, that material in blue jeans. But when you get into an accident, like at work or a motor vehicle accident, you can suddenly lurch forward, your spine goes forward, your head goes forward, and it tears the back of the disc. And when you get that tear, now the jelly in the center can actually leak out. It doesn't leak out like water. It gets pushed out by regular activities like lifting things, playing sports, anything, just normal activity pushes the jelly or nucleus out through the tear, okay? Which, by the way, normally the nucleus cannot get out of the tear. It can only get out of the tear, only get out of the disc when there's a tear. So you got to have a tear first. And that's something else that we discovered at Deuk Spine that other doctors don't know, is that the annular tear is the first step for all disc problems, It's called an annular tear, and it happens in the back of the disc called the posterior annulus, because there's a lateral annulus, there's an anterior annulus. We went through the anterior annulus to get here, okay? Look at all this herniation right here. This blue stuff is the herniation. It's stuck in the tear, and it's creating that inflammation, which you just saw on the video. Your body is attacking, trying to get rid of this stuff, but it can't because there's too much. See the blue stuff? And it makes it turn blue. Normally the nucleus is white, and it turns blue with our dye because it's degenerated. And the only way it gets degenerated is when the body's inflammatory system is attacking it. So you can't get a degenerated nucleus without inflammation from the body. A normal nucleus will not stain blue. So I know we don't talk a lot about this on our videos, but today we're talking about it so people understand. Any questions from our audience? There's a herniation.
Yes, we have a question from Lanu on YouTube.
Lanu. All right. Very good.
Saying, a business question. Monthly expense is very high at the facility. All the expenses are checked and verified. Do you audit monthly expenses, or is someone assigned for this task?
Yeah, I don't audit the monthly expenses. I just ask, do we make enough money to stay in business every month? And the answer, thank God, has always been yes. But our expenses are very high, as we've talked about before. You know, our expenses vary month to month, but they're very high. We have a CFO who monitors all of our expenses and our revenue to make sure we're staying in the black, because there is no way to go in the red because there's no money. We don't have investors. We don't have a bank loan. We have to just pay our bills every month from what we collect. So if we don't get donations. So if we don't collect enough that month, then where's the money come from, right? So I have to pay out of my pocket. That's what we would have to do, and I would take from my savings to pay, which I don't want to do. It's not right, but you know, I shouldn't have to fund other people's surgeries and their well-being. So I'm glad you understand it's expensive running a facility. I remind my staff of that all the time. As a matter of fact, when I'm walking around, if I see lights on a room, I turn them off, you know, to save electricity. Our electric bill is $11,000, $12,000 a month. So anything I can do to reduce that bill. This is a herniation right here. This is a piece of herniation. It's too big, and I'm cutting it with a laser to break it into smaller pieces so I can get it out. See that, how effective the laser is? And those small pieces, we can float them out. Last time we did this, we talked about how some of these pieces are so, there's another herniation. Oh, that's a big one. Look at that. That's a herniation. Remember I told you guys that we get like literally 30 per disc? So when people talk about a herniated disc, it's not one herniation, it's literally like 30 pieces. And look at them, this is scarred. So it's not going to come out without a laser. You got to use the laser. This is an annular debridement, okay? Oh, look at that. I'm going to try to grab it out. We'll see if I can, because it's just not lasering out very well. Keep the questions coming. If there's no questions right now, we can go to, it's a pinch. not a
We
grab.
do have another question
Yeah,
coming from Lanu once more on YouTube,
I don't know if I got it. Nothing. No. Yes, Lanu.
asking, are there any food or vitamins that can strengthen the annular tear?
Are there any food or vitamins that strengthen the annular tear? No. There's only one treatment in the world. That's what we're doing right now. I discovered it, and we do it right here at Deuk Spine. There's nothing else that works. The tear needs to close. That's the only way to heal your disc. Close the tear. The tear will not close until you get rid of the herniation. The herniation will not go away without my surgery. The other way to get rid of it is to scrape it out with scrapers, but then that means you're doing open surgery and you remove the whole disc. So that's what we do with an ACDF if you do it properly. Lots of surgeons don't know how to do it because they're not trained properly to do it properly. But with an ACDF, you have to take the whole disc out in the front to get to the piece in the back. And then when you're done, you got to put something in that disc space. And what we put is a cage or an artificial disc or a piece of cadaver bone or the patient's own bone. Point is, you don't want that done because that's not normal or natural, and it creates problems for people. But that's what all these surgeons do. They all put a piece of plastic or metal or dead person's fibular bone in there or iliac crest bone graft. All of those are bad choices. Next question. Almost done here. I got about 3 minutes on this disc, hopefully.
At this moment, no current questions.
Let's run our video showing people how this procedure actually works. All right, welcome back. You can see from our video that the Deuk laser disc repair actually uses a laser endoscopically to see and clean the tear with the laser. The laser is precise to about, with my technique, 0.05 millimeters, 0.05 millimeters. That's 1/20th of a millimeter, by the way, for those of you who need some help with the math. A regular surgery like ACDF, PCDF, typical surgeries done for years, those are precise to about 5 millimeters at best, 5 millimeters. So we are 0.05, we're 100 times more precise with the scope and laser. I can literally peel off a bone spur or herniation here at 0.05 millimeter depth. The glass fiber you're looking at right now is our laser fiber. It's an optical fiber. That fiber actually is 1/2 millimeter wide, less than 1/2 millimeter. Okay, it's 0.45. So think about this. See how thick it is? That's 1/2 millimeter. Let's just say 0.5. So I can vaporize 1/10 of that diameter away with this laser. You can see it. It's easy to see. Just about done. Probably 1 minute left. Remember, we started at C5-6. We're gonna move on to C4-5 next. See how the more calcified pieces just kind of, they don't float up as well? They sort of sink. Henry, do you have our DPR animation by any chance, or facet joint, cervical facet pain?
I actually do, yes.
Let's show our audience the second most common cause of neck pain is the facet joints.
Copy that.
And the facet joints are small joints located in the back of the neck. And after we end up fixing a herniation, a lot of times patients have facet pain. And sometimes you don't know they have facet pain until after surgery. So they come back in and they're complaining of pain in their back or neck, and you examine them, and what do you find? Well, they got pain in their facet. All right, so that is the foramen on his left at C5-6. This is all scar tissue from the inflammation from the herniation, scarred up posterior ligament. And I've taken all the, foraminal ligament fibers down. You see that? And there's a nerve root down there, and I'm not going to mess with that thing. But I don't see any more herniation. It looks good. Gotten rid of about 80% of this herniation. Okay? On both sides. We're done at 5-6, irrigation.
Thank you.
All right, are you going to play the video?
Yes, sir.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. We are now moving from C5-6 up to C4-5. This move is called the Deuk spine shuffle, or slide, I should say, slide. The shuffle is different. That's what we do during our DPR. But this slide is a slide along the anterior longitudinal ligament. Perfect. Show us the midline there, Jordan, as you move back into position. We are moving from one disc to the next, and there's only one way to do this properly. You got to slide the tip of the dilator along the anterior longitudinal ligament, okay, lateral, which is located between the longus colli muscles in the center of the spine. Shot. That feels pretty good. I'm going to go up to the disc shot. Give me shot AP. All right, let's make sure we're in the middle before we go in. Now this dilator will literally spread across the fibers like we showed you earlier. Perfect. Lateral. The dilator has a pointy tip and it's going to spread the fibers. Okay, shot. It's not going to harm the fibers, it's going to spread them. I want to get one more AP. Just want to be 100%. Always got to be 100% sure. Cannot leave anything in this type of surgery to chance. 2, 3, 4, 5. That looks pretty damn good. We're right in the middle. I like it. I'm going to angle a little bit to his right because we're angling a little bit too much to the left. Shot. I am going to do a discogram, folks. Shot. Let's pipe clean. Yep. Any questions? Shot.
Yes, we have a few questions. This next one coming from Lanu, once more on YouTube.
Hi, Lanu. Sure.
Asking, my aunt told us one of the biggest monthly expenses at her medical facility is the equipment and its maintenance. Is this accurate?
It might be accurate at her facility, but not here. I mean, the equipment is millions of dollars worth of equipment, but once you buy it, maybe she financed it, so she had to pay it monthly, but I bought it. So we've paid for it. That said, honestly, our payroll, let's go AP. Our payroll is probably one of our biggest expenses, if not the biggest. Everything is expensive. Rent, payroll, electric. That looks pretty good. Yeah, that looks pretty damn good. We're in the disc. We're off to the left side where we're supposed to be. You can see there's a big herniation there. I want to get this back a little further. Shot. That's perfect. Shot. All right. Probably have 10, 15 minutes left. Dr. B. Shot. Shot. I mean, legal fees, you know, that's expensive too. Trying to get paid from the insurance companies. The insurance companies do something to doctors and hospitals they should never do, and that is not pay them. And then when they're caught not paying us, they fight us and cost us more money to try to collect the money they owe us. And it's horrible what's happening in medicine. We have to spend tens of thousands of dollars a month just trying to get paid for a few surgeries they don't pay us for. So we didn't, not only do we not get the money from, 5 years ago surgeries, 4 years ago, 3 years ago surgeries, but we have to hire lawyers and pay them, $1 million a year just to try to get our money. It's horrible. So, yeah, I don't know, if your aunt had different cost structure, but our expenses are very, very high for such a small facility. And it's regulatory compliance, personnel. There's just a lot of money being spent, huge amounts of money being spent. So it's very expensive to run a facility like this legally and safely, properly. And yes, equipment is a big part of it. Thank God we have money to buy the equipment, and we have bought it. But this facility is a $20 million facility, and it's a 20,000 square foot building. So it's not that big. There's lots of people with homes, basketball players that have homes bigger than our facility. And
Jewelry, more expensive
jewelry more expensive. So the sad thing is that we shouldn't struggle every month. I shouldn't have to worry about our bills, but I do because the margins are not great. And the insurance companies don't want to pay. They just try to get out of paying as often as they can. And there's no laws that protect us from the insurance companies not paying us because they write the laws in America. The insurance companies write the laws. So they write laws that basically if we try to collect money from them for the surgery and we have to spend, you know, $500,000 on that surgery to get the lawyer, pay the lawyers to fight them and get paid, we may get $100,000, but we spend $500,000 in legal fees. And the laws are written that we can't collect our legal fee money. So they know, that's why they wrote the law that way. You understand? It's very sneaky. But our biggest expense is the insurance companies. Everything they do to make it expensive to practice medicine, from, you know, having to buy an electronic medical record and maintain an EMR system, having to hire more staff, extra staff that we really don't need for patient care, but they force us, having to hire lots of billing staff. Oh my God, how many billing people do we have for just 3 doctors or 4 doctors, right? We have so many billing staff. We have like 10 billing staff. No, more than 10. Sorry, we have about 25 billing staff if you include authorizations and front desk, everybody involved. At least, huh? Yeah. 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 Jesus Christ. Yeah, they stole from you guys. Thank God we haven't been stolen from. But basically, let me explain something to you. We have 4 doctors here, okay? And for 4 doctors, we have 75 employees. 75! And that's with me, like, being frugal and trying, you know, to make people do more than one job. Right? Right, Nikki? So, you awake? 75 employees is ridiculous for 4 doctors. It's ridiculous. So my dad was a doctor back in the 70s and 80s, and he ran a private practice, just like I do. And he had 3 employees. 3. That's all you needed back then, because the way the regulations were, you know, you just had to write handwritten note. It could be very brief. There was no difficulty getting prior authorization, prior certification. There was no difficulty getting paid because they took the money from the patient. They sent the bill to the patient sent the bill to the insurance, and the insurance paid the patient. That's how it should be today. Because the insurance will screw the doctors and hospitals over, they won't screw the patients over. Not every patient like that. So what the insurance companies have done over the years is changed from paying the patient to paying the doctors, and then not paying the doctors and hospitals. And that's the problem. And then by not paying the hospitals and doctors, hospitals are going out of business. Doctors are going out of business. Doctors used to be 90% private practice, 10% work in the hospital for the hospital, 90% private practice. Now, 90% work for the hospital because they can't afford to make their own practice. They can't run their practice. They don't have the money. The reimbursements have gone down to the point that doctors are going out of business. Let's face it, doctors are not good business people. I'm not saying we are. We shouldn't be. But we should make enough money to stay in business, stay in practice, to help patients, right? But the insurance companies have cut and cut and cut what they pay us over the years, and their profits have gone up by billions and billions by their cutting hospitals and doctors, and hospitals and doctors are going out of business. So our biggest cost is not equipment. Our biggest cost is personnel to try to get paid. You know, rent is expensive, very expensive. So anyway, great question. I don't mind talking about the business side a little bit. Who's next?
Next question coming from Lynn on Facebook,
Hello, Lynn.
asking, will this procedure last as long as an ADR? What helps cushion the missing disc area?
Yeah, great question. This procedure will last longer than an ADR. ADRs, unfortunately, don't last in most patients. They end up having to have additional surgery or treatment. And that's not the case with this surgery. This surgery is permanent. It lasts your whole life. And as far as the cushion, there's still a cushion. We're not taking the cushion out. With an ADR, you're taking the disc out. Okay? I told you earlier, to get to the back of the disc, the surgeons take the front of the disc out, like the whole disc out. We don't do that with this surgery. We're leaving the disc here. What you're seeing, remember, you're looking through a 3 millimeter tube. Actually, 2.8 millimeter tube. Not even 3 millimeters. That fiber is 0.5 millimeter. So what we're seeing is very small. 5 minutes, 5 minutes, 5 minutes. So we're not, it may look big to you because of the endoscope, but this area we're operating in is tiny, tiny, tiny. So we're not taking the disc out at all. We're actually repairing the disc. Okay? Good question. With ADR, horrible procedure, I wouldn't do it. You don't want a piece of metal in your neck. They've sold you guys on ADR, you know. They lie to you and tell you you need it, that it's better for you, but it's not. That's because big companies make billions of dollars in profit selling those artificial discs to you, to put in your body. And they won't make those profits if they don't get you to agree to put it in. So they've come up with some really good, clever marketing that a lot of people fall for. Like, oh, there's no disc left, you need something in there, a spacer, but you don't. There's lots of people with 0 disc left, and they have 0 symptoms. Millions of people, not lots, like not a few hundred. I'm talking about 90% of patients with degenerative discs don't have symptoms, and we don't treat them. We don't put ADRs in them. So it's not the fact they have no disc left that they need an ADR, it's the fact they have symptoms. Well, those symptoms can be eliminated with our surgery without putting an ADR. This is far better than ADR. This patient, by the way, is going home in an hour. Home. And there's no metal being put in his neck, no fusion, no ADR. So he's not going to get adjacent segment disease like you get with ADR. They found that ADR causes adjacent segment disease, as just as bad as fusion does. All right, pretty much done. I'm going to just clean these last bits. You can see how there's really no more herniation. Looks good. Very happy. We're pretty much done. That's the foramen there, the left foramen. Any other questions?
Yes, we have so far 2 questions. This next
One
one
last look.
coming from BJ on YouTube.
DJ or BJ?
BJ.
Okay. Is that appropriate?
I believe so. I think it could be Barry Jones. But
All
this
right.
coming from BJ on YouTube asking, you're not planning retirement anytime soon. I need help. I have ruptured cervical disc pain and headaches. My surgeon showed me a different artificial disc he would use each visit I had with him.
Jesus. Yeah, it's because the last time they offered him, or the next time they offered him more money for the next artificial disc. These surgeons are on the take, by the way. They get paid to put these artificial discs in. Oh, they get paid to do the surgery like they're supposed to. But they also get paid by these companies. And there's ways they get paid. And they're unknown to you and unknown to our government. But they do pay taxes on them, and they're supposed to report them. And there are things like consulting fees and royalties. Trust me, I know. I used to be a big spine surgeon putting a lot of metal in patients, and all these companies would try to wine and dine me. They would come and talk to me and bring me lunch, and I would always make them buy lunch for all the staff, 75 people. And then I wouldn't buy any of their stuff. That way, you know, my staff got a nice treat. Yeah, I wouldn't put anything in, you know. It's crazy. You don't need it. I'm not retiring. I could retire. I could have retired 10 years ago. I have plenty of money I could live off of. When I was in medical school, I lived off of $10,000 a year. And I'm used to being poor. I'm happy to be poor. I don't care. I just really like helping people get out of pain, and it's unfortunate that I'm one of the few people that can actually do it. So how can I in good conscience retire when I would be denying so many people a better quality of life? So I believe it's my mission to stay here and work until I drop dead. And 20 years from now, Dr. Berndes will be doing EKGs on me every day when I come in just to make sure everything's working, right? Daily EKGs, right? All right. Here's the incision, folks. Remarkable. You don't need that big incision on your neck that screws up your swallowing and screws up your voice. 4 millimeters. 4 millimeters. You see that, Henry? 4.
Yes, we do.
Done. No bleeding. Wonderful. Thank you, Luis. Great job. Everybody, type up your questions. I'll come answer them for you. Thank you so much. And the next case is going to be a lumbar Deuk laser disc repair. A lady with such crippling back pain that she's now in a wheelchair for the last 2 weeks. She can't even walk. And she's been deconditioned for a long time. And we're going to fix her. To answer questions.
I'm here with my patient who traveled from California, Northern California. He had a herniated disc at C5-C6. It was a small disc bulge. He was told by the doctors in California that he should just live with the pain, give it time, and eventually he'll need a fusion. Is that right?
That is correct. I was told that within 5 years I would be needing surgery. So basically what they were saying, live with pain for 5 more years and then we'll do something about it. One of the things that I've seen a lot of the videos is testimonials, and I will always say, this doctor sounds too good to be true. And actually it is true. I appreciate you, doctor. I really think that is really nice procedure, and the staff here is really nice. They're always very friendly and kind to get you through the process, because when you get told so many times that that's your new life, it's kind of, you're always thinking, is really the way I want to live? If I'm going to live a lot of years, why wait with pain? You know, you need to do something different. And always, whenever you see videos, you're always a little sketchy and saying, maybe it's not true. Maybe this is not what it is really saying. But today, when I felt with no numbness and no pain on the neck and just going through the process, I really been blessed. I'll be flying to California today. I honestly can't say much. You know, it's a miracle. Whenever I heard the testimonials, they say you're a tool for God. It actually seems like that's the way it is. It's a miracle through you. God works through you, and it's awesome to feel better, you know?
I'm so happy for you and your lovely wife who's here with you. You can see you had a tiny little incision. You had the Deuk laser disc repair for your herniated disc. You can see we were in there with the laser, cleaning out that foramen on the right side where the nerve was being pinched. There were a lot of pieces of herniation in there. And the laser cleaned them all out, and your surgery went perfect, and here you are less than 24 hours later. Feeling good, huh?
Well,
With
yeah.
a smile on your face. That's what I like to see.
You know, it's a smile of happiness. It's a smile of joy, you know, that it is doable. And I think no one should be able to be living with pain. I was so happy to see testimonials when they used to say, well, the one regret I have is not going in earlier and living 18, 20 years with pain. For me, it's been 3 years since July of 2020. It's been miserable because I've been with pain. And I've been told by doctors, let's just take time. I did all kinds of physical therapy, acupuncture, you name it, everything that's out there, and nothing seemed to help. And today, with 1 day of getting something really that's gonna be for life, it's amazing. It's a smile of joy, you know? If you are going through this trouble, don't hesitate on sending your MRI. When I did it, I sent my MRI for free review, and my answer was, yes, you are a candidate. Here I am today, flying back with literally no pain on my neck and no numbness on my hand, which I miss that. That's awesome.
It's wonderful. Now, what is your native tongue? What is your native language?
It's Spanish.
Are you from Mexico originally?
Guadalajara, Jalisco, Mexico.
Guadalajara.
Yes.
One of my favorite songs. Can you tell them in your native tongue how you feel?
Ya, quisiera decirles que si están teniendo problemas con una hernia en su cuerpo, manden su MRI, ya, es gratis y les van a dar un resultado, una verificación si ustedes son candidatos. No vivan con dolor, porque el dolor les va a causar toda la vida y los doctores allá afuera les dicen que no hay solución, pero las soluciones existen, simplemente las tienes que buscar y creer, tener fe que tú vas a estar mejor. Si Dios te mandó a este mundo es para que vivas bien, no para que vivas con dolor. Así que te recomiendo que por favor tomes esto en serio, hagas ese paso de mandar tu MRI gratis y habla ya sea con quien tengas que hablar para que ellos te empiecen a guiar y te digan qué es el siguiente paso que tienes que tomar. Así que una recomendación con Dr. Deuk. Muchas gracias.
Muchas gracias, amigo. And Feliz Navidad.
Feliz Navidad. Gracias.
Safe travels, my friend. Thank you so much for sharing. Dr. Deuk Majan, CEO and founder of Deuk Spine Institute, Deuk Joint Institute. I'm here with our patient from
Louisiana.
That's right. I had to have him say it. He sounds better when he says it. Why did you come all the way to Florida to the Deuk Spine Institute?
Well, about 3 months ago, I was scheduled for a cervical disc fusion in Shreveport, Louisiana. Had done all the pre-op stuff, was scheduled within 2 weeks to do the surgery, got to work and started doing some research. The more I read about what they were going to do with the fusion, people having trouble with it down the road, above and below the fusion, decided there had to be a better option. So that's when I found Dr. Deuk and his team and started watching some of his videos. Pretty impressive.
And you're a YouTube guy, you were
Yes,
telling
sir.
me, so you found us on YouTube. And what did you think?
Well, our first impression was any doctor that will put his livelihood live on YouTube, showing all of his surgeries, putting it out there, believes in what he's doing. That's not many doctors would do that.
Not just because of that, but because, afraid of complications, which, praise God, we haven't had a complication. We've been doing it now for 17 years. I want people to know there's a safer, better way to take care of their problem other than metal, fusion, stimulators. That's really the message there. You got that message loud and clear.
I did. My surgery was less than 24 hours ago. So far, the tingling, numbing going down my arm is non-existent. It's went away where it was there constantly all the time before. So hopefully this continues on.
Oh, it's gonna continue on. Our results are permanent with the laser surgery. And you can see your tiny little incision right there. It's a 4 millimeter. You can see we went in with a little tube into your disc. I was able to get both discs fixed. You had a lot of herniations in there. Something a lot of people don't understand. They think that a herniation is one piece, but it's about 30 pieces on average. And you had about 30 pieces in each of your discs. They were hard to get to, but we got it done. And I was very happy with the end results. We got all the pressure off the nerves and we fixed the tear in the back of the disc. Less than 24 hours, here you are. You're doing fantastic. Now, what did your wife think about you coming down here to Florida? Was she supportive?
She was. This problem had been going on for many years. Started out on my right side years ago and had some stuff fixing that, but she knew the problem I was having. I'm very active. I'm a scuba diver, a motocross racer, do a lot of active sports. And
All right, fantastic. So let's fix the camera.
Perfect.
Good. I'm Dr. Deuk Majan. You just watched me in the operating room going through a patient's neck through the front right here. So the patient had a tube coming out of their mouth attached to the machine, breathing for them. They were completely asleep under general anesthesia. I relaxed their muscles in their neck and I literally went down to their spine with my fingers. I put a needle in and went right through the front of the disc to the back. So here's what it looks like in the front of the spine, bones, disc. I went through the disc to the back where the herniation is, and I put a little tube in there and I just used the laser to remove all the pieces. Somebody asked about artificial discs. That's an artificial disc, okay? Horrible thing. They make it look sexy and beautiful, but in reality, who wants a
chunk of metal in your neck, restricting your movement, having complications. There's all kinds of bad things that happen with artificial disc they don't talk about. So, you know, I would avoid them. Why have an artificial disc if you don't need it? There's a lot of push for metal implants and spines these days. It's really a scam, a spine scam. And you folks out there don't need it. 99% of your pain can be cured with one of our treatments that's done outpatient percutaneous without metal. Either the Deuk laser disc repair, which you just watched, the Deuk plasma rhizotomy, which is even less invasive with a little probe that burns and kills pain nerves, or the Deuk piriformis release, which is releasing a muscle in your buttock that causes pain. 99% of chronic back pain is those three things, plus the sacroiliac joint, which we can fix with a DPR. So only 1% of chronic back pain, like fractures, is fixed with things like kyphoplasty, which is equally minimally invasive. They put cement in your bone. Basically, there's no need for metal screws, rods, cages in degenerative disc disease or degenerative spine conditions, which you all have. If you have tuberculosis of the spine or infection or tumors eating your spine away, then, or fracture dislocation from an auto accident, in those situations you probably need instrumentation, metal, but degenerative conditions you don't. Okay, we're proving it every day. We have questions.
Yes, we do. This first one coming from Big John on YouTube.
Big John, nice to hear from you.
Saying, good morning.
Morning.
I have a dermatome and a myotome question. As an example, does the axillary nerve feed both dermatome and myotome, or do dermatomes have a separate nerve than a myotome?
Yeah, great question. Does the axillary nerve feed a dermatome and a myotome? I don't remember. I think the axillary nerve is more motor, more muscle, but there could be a small patch of skin that it innervates around the shoulder. I can't remember. You have to go back to the textbook and read about it. But what Big John is asking are nerves, like these nerves right here. These are actually nerve roots. They come off your spinal cord. They go out into your shoulder, and then they start mixing it up with each other like a little nerve party, and it's called the brachial plexus. And then off of the brachial plexus are a bunch of nerves. Almost all those nerves have both muscle innervation and skin innervation and joint innervation. So you're getting skin feeling, muscle contraction from those nerves, you know, control from your brain telling the muscle to contract through the nerve, and then joint, like where's my joint in space, or is my joint hurting me? So all of those nerves coming off the brachial plexus, except for like one or two, are mixed, motor and sensory.
Next one coming from Lanu once more on YouTube.
Hi, Lanu.
Asking, your fees are low and the profit margin is small. Why don't you increase the fee?
We keep our fees as low as we can so that people can afford to pay for our surgery when their insurance won't cover it. Yeah, we want to help people. We're not trying to take advantage of them or rake them over the coals. We want everybody to get out of pain. Unfortunately, our fees are not low enough for a lot of people to afford the surgery, which bothers me every day. I wish to God I had a Mark Zuckerberg or Bill Gates or someone who would create an account with $100 million in it so that we can take the interest off of it and pay for people's surgeries. Get a board and have people apply for financial aid and then cover their surgery. Yeah, nothing would make me happier. I wish our fees were lower.
This next one coming from Justin K on YouTube. Saying, hello Dr. Deuk, I had my MRI review. What do I do next? No one has contacted me yet.
Ooh.
Just got an email saying that someone will, but no one has yet.
Well, Justin K, if you had your MRI review done, today is Thursday, yesterday Wednesday. If you had it done yesterday, then it's too soon. Somebody will contact you probably by the end of the week. If they don't, then let me know here in this platform, or respond to Sam, who sent you the MRI review, who sent you the email afterwards. If your MRI review was last week, that's a problem. If it was on Friday, you should have been contacted by now. If not, let me know and I'll talk to the person that's supposed to contact you.
This next one is coming from Rita on YouTube,
Yes, Rita.
saying, "Hi, doctor. Before my mom passed, the doctor said that meal was good. We didn't understand."
Neil?
Meal. I don't know if that means meds or meal.
Hmm.
He said exactly what you did. He'll go for the meal, but if he doesn't believe in the meds, he won't give. He gave $5 meds, worked on my mom. Thank you for your honesty. Very few of you. I dream of getting to you. I'm in so much pain. The doctor won't agree,
Neil.
and I'm not working immunocompromised. 2 car hits, back, hip, and knee. I'm asking everyone who's watching, please hit the thumbs up. We're watching and getting help. We should help too. Thank you, Dr. Deuk. Saw Dr. Davis pick the pick in Italy. Yeah, I posted that.
Give me 1 second. Dr. Manguikian. Sorry about that. I had a call from a doctor's office, so yeah, thank you so much for mentioning that. What can I say? I wish I could help you more. Sounds like you need our help in a bad way. You've got all kinds of orthopedic issues, spine and joints. That's what we do at Deuk Spine. We fix those kind of problems, so hopefully you can make it here.
And then ending just saying, God bless you all, you deserve a nice vacation.
Thank you.
This next one coming from William on Facebook, saying, I've had 7 surgeries, 2 in the neck and 5 in the lower back. I have herniations and bulges below and above my fusion. Spine stimulator isn't working. How would your procedure help?
Yeah, thanks for your comment. The way our procedure works is you're having pain. There's a source to your pain. I find the source, which is probably the herniated disc or the sacroiliac joints or your facet joints or your piriformis muscle. All right? And then once I know where your pain's coming from, which disc, which facet, which piriformis, which SI, we go in and repair them with the laser or plasma. It's that simple. So I'm sorry you've been through horrible fusion surgeries and laminectomies, stimulators, all totally unnecessary. We would fix you with our laser or our plasma, and we do it all the time.
No current questions, just a last comment coming from Justin K. once more on YouTube.
Oh, by the way, do the MRI review. We'll figure out what's wrong with you, okay? It's free and virtual, so you don't have to come here. Just do it on the computer.
And then lastly, just a comment from Justin K. once more on YouTube, just following up on their last comment, saying that they had the review last week, Wednesday.
All right. Very good. Last week on Wednesday.
Yeah.
So, okay, well then we need to know this person's name.
Yeah.
Do we have it?
Justin K. on YouTube.
I mean, I don't know if that's the real name or if that's just
Yes,
their handle.
I don't have the name with me at this moment. I do.
Justin K. I could certainly look from last Wednesday and see if we have a Justin K. But if we don't have a Justin K,
Oh, they just revealed the name. The name's Nagesh Kanbin.
okay, we're going to find out.
Yeah.
We're going to have somebody contact you today, Nagesh. All right?
Yep.
All right, thank you.